Sexually transmitted diseases, often called STDs, are infections that are gifted during intimate acts. This phrase is not entirely inclusive, as many diseases, such as the flu, can be transmitted between two people whether or not they are wearing clothes. STDs come in two natural flavors, bacteria and viruses. Bacterial STDs create some curious symptoms but are curable with antibiotics, whereas viruses are much more resilient. For those looking for a more durable gift, some viral STDs come with a lifetime guarantee. Chlamydia is a bacterial STD that infects the urinary tract of about 1 million men and women in the United States each year. Most people with this infection have no symptoms until bacteria creeps towards the uterus in women and testicles in men. Painful urination and pus from the urethra are common symptoms. Severe complications include pelvic inflammatory disease in females and blindness in newborn infants that travel through an infected birth canal. Gonorrhea is a slightly less common bacterial STD with many of the same benefits as chlamydia. Many women are asymptomatic, unless they develop pelvic inflammatory disease, and most men have painful urination and white discharge from the tip of the penis. Syphilis is a bacterial STD that is relatively uncommon in recent years. This is likely secondary to the common occurrence of a large, painful genital ulcer, something that sends most people running to the doctor. Papillomavirus produces genital warts in women and men, but may cause cervical cancer in women. It is now recommended that preteens receive a vaccine for several strains of the papillomavirus to reduce the risk of cancer in women. Herpes comes in two lovely varieties, type 1 and type 2. Type 1 produces cold sores and is typically not considered a sexually transmitted disease, although it may be spread through intimate contact. Type 2 herpes is the interesting one, as it can cause recurrent, painful genital blisters in both men and women. About 50 million people in the United States have herpes type 2. There is no cure for herpes, but there are medications that reduce the chance of outbreaks. Bacterial STDs can be cured, and viral STDs can be controlled with medications. All suspected STDs should be discussed with your doctor, for this is why they make the big bucks. It is also fun to ask your doctor about STDs at the grocery store or at dinner parties.
Remember, to all you sofa doctors out there, diagnosing or treating anyone based on internet videos is generally a bad idea.